Let's pretend you're a registered dietitian working in a hospital setting. You have a patient who's been receiving tube feeding through a nasogastric tube, but now it's clogged. A nurse approached you and asked, "What should we do?" You didn't know what to say, so you went to YouTube and started watching this video. According to the American Society for Parenteral and Enteral Nutrition's Safe Practices for Enteral Nutrition Therapy, the first thing you should do to unclog a feeding tube is attach an empty 30 or 60 milliliter syringe and pull back the plunger. This action attempts to dislodge the clog through suction. After pulling back the plunger as far as it can go, you detach the syringe and fill it with warm water. Then you reattach it to the tube and gently push the warm water through. If the water flows through without resistance, it means you dislodged the clog and should focus on preventing it from happening again. But if the water is met with resistance, as in the plunger won't go all the way down, it means the clog is still there. Wherever the resistance occurs, you should carefully move the plunger back and forth several times with short strokes to try to loosen the clog. Then you should clamp the tube with the warm water still in it and allow it to soak for up to 20 minutes to soften the clog. Once the 20 minutes is up, you should attempt another warm water flush to see if it passes through. If attempts to unclog the feeding tube with warm water are unsuccessful, the next option is to try an activated pancreatic enzyme solution. Here, you mix one uncoated pancreatic enzyme tablet, one uncoated 325 mg sodium bicarbonate tablet, and 5 milliliters of water. The only FDA-approved uncoated pancreatic enzyme is called Viocase. You gently push that solution into the feeding tube with the syringe, and clamp the feeding tube for 30 minutes to give the solution a chance to break down the clog. The American Society for Parenteral and Enteral Nutrition doesn't say how many times to do this before it's considered unsuccessful. However, they say if the clog is not cleared within 30 minutes, the solution should be removed from the tube and replaced with a fresh mixture, which suggests it's worth trying at least twice. As an alternative to the activated pancreatic enzyme solution, clinicians can use a commercial enzyme declogging kit or a mechanical declogging device. Commercial enzyme declogging kits like Clog Zapper contain a syringe with pre-mixed and preloaded ingredients that can help to dissolve a clog through a chemical reaction, whereas mechanical declogging devices like Tube Clear feature a thin wire that's guided into the feeding tube to break down the clog through mechanical force. Both of these options can be helpful, but at this time, they're less readily available to clinicians than the ingredients for the activated pancreatic enzyme solution. Finally, if you can't fix the clog with an activated pancreatic enzyme solution, a commercial enzyme declogging kit, or a mechanical declogging device, the last option is to remove the feeding tube and place a new one. Replacing the feeding tube corrects the issue, but isn't a first or second line approach because it requires the greatest amount of resources and carries the highest risk of complications. If you're enjoying this video so far, make sure you hit the like button, share it with a friend, and shop for more free and exclusive content by clicking the link down in the video description. Even though most registered dietitians working in the hospital aren't responsible for unclogging feeding tubes, it's still important to know how to do it for two reasons. First, some nurses don't know how to unclog a feeding tube and will ask you for help. Second, some nurses insist on using methods that are not recommended, and corrective action is needed to improve patient care and safety. The most common mistake I've seen nurses make is using carbonated beverages like cola or ginger ale. While the fizziness of these solutions may seem desirable to fix a clog, not only are they ineffective, but they can also be counterproductive because their acidity can make the clog worse. Therefore, carbonated beverages should be avoided, as should using any other acidic beverages like juice or coffee. Other common mistakes nurses make when trying to unclog a feeding tube include using hot or boiling water, using meat tenderizer, using unapproved wires or brushes, and forcefully pushing liquids through the syringe. All of these actions can threaten the integrity of the feeding tube and gastrointestinal mucosa. Thank you for watching. Don't forget to like the video and subscribe to the channel.